Can you believe there is still no cure for the common cold? It's hard to believe that in most cases, you just have to sit and wait it out. That is hardly reassuring to a sniffly, achy, and ill-appearing child. So we've developed a few things along the way to help relieve the symptoms and ease the pain. Here's Allison to tell you a little bit about them.
Hi, I'm Dr. Allison Evans, and I'm here to talk about children and colds. Let's take a look in the medicine cabinet first. Acetaminophen or ibuprofen. Either one is fine based on the package recommendations for age or weight. Aspirin, not fine. Not for kids under 12 and not for kids or teens under 19 with viral illnesses because it might increase the risk of a serious condition called Reye syndrome. How about over-the-counter decongestants or antihistamines? Although the temptation is great, please know that no one has proven that these medications actually work. In fact, decongestants can cause hallucinations, irritability, and irregular heartbeats in children, and they should not be used in kids under the age of 2 without first consulting a physician. Here are some safer and surer ways to ease a cold's discomfort. For nasal congestion, try saltwater or saline nasal drops. These are great because you can find them at any pharmacy. A cool mist humidifier will help to increase air moisture. To soothe your child's nasal rawness, try applying petroleum jelly on the skin under the nose. A warm or cool drink could help relieve your child's sore throat. For muscle aches and pains, try a warm bath or a heating pad. And the steam from a hot shower could help your child to breathe more easily. Lastly, don't forget the chicken soup. This classic contains a mucus-thinning amino acid called cysteine, which some studies have shown actually helps to control congestion-causing white cells. Overall, the best plan is to make sure that your child eats when hungry and drinks plenty of fluids. But definitely not caffeinated beverages. These can cause frequent urination and therefore increase the risk of dehydration. Okay, so you've taken care of your child's symptoms and we know that his cold can't be cured. So why bother with a doctor? Although it's true your doctor cannot identify the specific virus causing cold symptoms, he or she can examine the throat, ears, listen to the lungs, and take a throat culture to make sure that the symptoms aren't from something other than a cold that may require specific treatment, such as allergies, asthma, or even pneumonia. See your doctor if you think that your child may have something more than a cold or appears to be getting worse rather than better. Here are some symptoms to look for. Increased mucus production, shortness of breath, unusual tiredness, the inability to keep food or liquids down, poor fluid intake or poor urine output, increasing headache, facial or throat pain, a very painful sore throat that interferes with swallowing, fever of 103 degrees or higher, or a fever of 101 degrees or higher that lasts for longer than 1 day, chest or stomach pain, swollen glands in the neck, and earache. Now you know some tips to help keep your child healthy for this upcoming school year.
Thanks, Allison. But one last thing, and this probably won't make your child feel any better. Keep him away from his classmates and friends until he's feeling better. There's no sense in them all catching it, right? For more information, go to kidshealth.org. I'm Dr. Daniel Leonard.